spent 24 years in the United States Army. I've taught at the Army's Command and General Staff College. I taught at Tulane University. There I taught the Army's Senior ROTC program, which is a program that produces officers for the U.S. Army. And for the last 6 years, I taught Army JROTC at a high school in Florida. I moved up here in June, and now I'm the Career Center Coordinator. My job is to help you figure out where you want to go when you grow up, leave high school. Let's just talk about healthcare as a profession. I've listed a couple of pros up here. Job security, personal satisfaction, respect. It's rewarding. You have a purpose. And for many of the specialties within the medical field, pays pretty good, right? And think about job security for a minute. If you're working in the health profession, you're never going to work out of a job. There are always going to be people who need your help, right? It's rewarding. People respect you for being in that field, right? Can anybody think of any other positive attributes to a career in the healthcare field? Crickets? Okay. What about some disadvantages? What are some disadvantages to working in healthcare? Go ahead. Okay. Some of the jobs have long work hours, don't they? Okay. Some of them require a lot of school. Not all of them. We'll get to that.
On call.
Okay. You could be on call, especially if you're in a position where you're in a small town hospital and you're an X-ray tech, and the emergency room staffed 24 hours a day. You're the only X-ray tech. You could be on call 24 hours a day, 7 days a week, right? Car wreck, 7-year-old kid comes in, his arm's at a weird angle. You got to come in and take the photos, right? So that's a potential disadvantage. What else? Okay. I thought of a couple. We talked about years of training. What if the fact that you're always working with sick and injured people? You get to meet people when they are at their worst. They don't feel good. They're hurting. They're cranky. And you've got to smile and be nice. Can that be a problem? Okay. You have to have the maturity to be able to say, look, I get it. This is probably not the way this person always is. You know, Mrs. Jones is probably someone's grandmother. The fact that she just called me a name that I can't repeat, probably not her normal demeanor. Body fluids. Okay? For a lot of these jobs, you're going to have to deal with messes. That's something you have to be able to get past, isn't it? And for many of the jobs, it doesn't matter whether you're the person that's tasked with cleaning it up, you're still going to have to deal with it. Okay? And we talked about the hours. Okay. When we talk about the healthcare profession, most often we think of doctors and nurses, right? Well, what about specialists? What are some of the jobs that you can do that don't require 4 years of college to start working? What are some of the jobs in the healthcare field that you can think of that you wouldn't have to go to school for 4 years for?
CNA.
CNA? Yeah. That's 1 semester. What else? Okay. Well, I just did a quick perusal of NTC. And this is a little bit small for you in the back, so I'll read out some of them. All right. Now, at NTC alone, okay, this is just one school in this area, There are well over 24 career options within healthcare that you can take that require 2 years or less of training. Okay? On the left here, you see all the associate degrees that they produce. All right? So starting from the top down, dental hygienist, fire medic. Now when they talk about a fire medic, that's a little bit of a specialized position. That's a paramedic that works specifically with the fire department. Okay? So you're kind of a combination of both a firefighter and a paramedic. Nursing. Okay? Now, we talked about CNA, but there's also the RN option, which is a 2-year degree. You can follow that up with some time at Stevens Point and get a Bachelor of Science in nursing. Anybody in here thinking about being a nurse? Okay, if you're thinking about being a nurse, go ahead and do the BSN option. It pays better, and it can lead to more leadership roles, and the one thing you will find in the world of business and work is that leaders always make more than followers, except maybe in the NFL. Coaches don't make as much as the star players. Paramedic, radiography, okay, x-rays. 2 years, you can basically be an x-ray tech. Okay? They've got veterinary science, healthcare business administration. This is a field that gets overlooked quite a bit. A doctor's office, a clinic, is, at the end of the day, a business, isn't it? Yeah? It's not, most of them anyway, are not-for-profit organizations. Okay? The doctors get paid, the nurses get paid. The whole point of the business is to provide a service to the public and earn a living for themselves. Somebody has to run the business side of that operation. Okay? The physician, say it's his practice, he's going to hire somebody to run the business side of that operation for him. Doesn't pay too bad. And if you're really good at it, you can move upward from there and get into bachelor's degrees and even master's degrees in healthcare administration and end up being the guys that run like the Aspirus or Marshfield clinics over here. Further you go up, the more degrees you have, the more money you make. Now this is one that doesn't suffer from many of those disadvantages. As an administrator of a clinic, you're not dealing with body fluids. That's someone else's job. You're not dealing with the sick patients, usually, unless they're complaining about their provider. In which case, you know, it's like being the store manager at Walmart. You're generally not on call. You're going to work your normal hours. You know, so you work in the healthcare field, but really, you're just running a business. Okay? Lab tech. Couple of options there, you know, but instead of dealing directly with patients, you're going to be dealing with specimens. Short of 2 years, okay, there are several others. Those are just the 2-year degrees. Below that, less than 2 years, and these can be anywhere from 3 credits, that's 1 class, up to about 35, based on what I looked at. So, up to about a year, year and a half. You got healthcare receptionist, medical assistant, coding specialist, medical office specialist. We talked about CNA. Phlebotomy technicians. Anybody know what a phlebotomist is? Yep. The vampires. Somebody laughed. Thank you. Surgical technologist. an advanced EMT, dental assistant, EMT, paramedic. Does anybody know the difference between these two? EMT and paramedic. Okay. Basically, in the world of emergency medicine, the ambulance crews, your basic level 1 is called an EMT, emergency medical technician. Paramedic is a level 2 or 3. Okay? And it's usually the level 2 or 3 that you find back over here working with the fire department. Okay? I have a cousin that does that in Mobile, Alabama. Me talking by now, most of you probably have figured out that I'm not from around here. Okay? Some folks tell me I talk funny. That's a very hectic job. Okay? It's shift work. You're on call usually for 24, off for 24 to 48. But if you like doing it, it can be a very rewarding job. Now, any of you think any of those careers might be worthwhile? Raise your hand if any of those jumped out at you as something you might want to look more at. Okay, okay. Which ones? What jumped out at you?
Dental hygiene.
Dental hygiene, okay. What about y'all? Which one did you like?
Well, I thought like the what is it? The fire medic was kind of.
Fire medic?
amazing, but,
Okay. What else? Over on this side.
nursing.
Nursing, okay. What else? Phlebotomist, okay. The point I'm making here is simple. It's not just doctors and nurses, folks. The medical system is comprised of hundreds of specialties that don't necessarily require a 4-year degree. Okay. So you can graduate from high school, study for 1 to 2 years, and immediately start working. You incur less debt, and you start making money. You can continue your education beyond that. Okay? Like the RN idea. Okay? NTC has a partnership with Stevens Point where you get your RN through NTC, and you get your BSN, or Bachelor of Science in Nursing, through Stevens Point. RN versus BSN. About the same level of medical expertise. But with that Bachelor of Science credential comes more money. So, for those of you that are thinking nursing, a pathway might be go to NTC, get a CNA while you're in high school, if you haven't already done that. Go to NTC, do their RN program, go to work. Enroll it at Stevens Point, and I think many of those classes are online. So you can take them when you're not doing your work your way up to BSN, and then move up from there. Okay? So there are several options and several pathways that you can pursue. And this is just NTC. Okay?
The nice thing about the RN to the BSN too is, for example, if you go to the tech and you get hired by Aspirus, they will pay for you to get your BSN. So that's a smart way to go about doing things too. Because and Aspirus loves to hire tech kids from a nursing standpoint because it's hands-on for the 2 years that you're there. So my daughter's doing that right now. So it's kind of a no-brainer.
And really, when you think about it, it is. All right? My advice to people when it comes to college especially is look for other people's money. Well, I mean, there are plenty of people and organizations out there that are ready to give you their money for you to go to school that you don't have to pay back. If Aspirus will pay for your BSN, why wouldn't you do it? Okay? Now, we're not done yet with NTC though. They have certificates that are not, it's a different type of credentialing than a technical degree or anything like that. It can be about the same length as the others. It's just a different type of credentialing. So you've got central services, which is patient admitting, things of that nature. A certificate in health services, anesthesia for dental hygienists. Okay? So this might be, for someone looking at dental hygiene, this might be an additional certification beyond that. And why would you want that?
It would make it more appealing to more places to
Yep.
get done.
More options for an employer because they can employ you in two different roles, right? It looks good on a resume. And number two, more money. Because if you're doing both jobs, they're going to have to pay you to do both jobs, aren't they? So you're going to make more than just a standard dental hygienist. So, more certifications, potential for more money. Office documentation specialist, critical care paramedic. Again, this is going to be on top of your regular paramedic. This is for someone that's looking for the ability to handle a critical patient on scene and stabilize them. Okay? Same thing, this would be on top of that. Emergency medical services leadership. Okay? Who might want that? What do you think that job would appeal to? Someone who is already what? Come on, guys. A little bit of audience participation would be nice. Who might be? What kind of person would pursue a critical care paramedic certificate? A paramedic. Right? What type of person would pursue the leadership certificate? Also a paramedic. Why? Because it allows them to move into leadership in, administration. Okay? And leaders make more than followers. So, if you're moving up the chain into a leadership role, that comes with better compensation. Okay? And money's not everything, is it? But it helps. You want to be able to pay the bills. And just getting, from going from a standard paramedic to either critical care or leadership, moving into a higher role may be enough to give you the ability to save to take the kids to Disney. Okay. Nice little bonus. Okay? Professional communication, tomography, patient services, and medical scribe. Okay? So, those are some of the things at NTC. Are there any fields that you see that you've thought about that aren't up there? Can you think of any fields that might not be up there? Go ahead.
Like a surgeon, but that's like more than 4 years of school.
Yeah. Now, when you talk about a surgeon, you're talking about a physician who's had undergraduate school, medical school, residency in surgery, and an internship. So, to become a surgeon, just a general surgeon, is probably 12 years after high school. Right? Now, if you want to specialize in orthopedics, the bone doctors, which 2 years ago, they were some of the highest paid members in the medical community, okay? You're looking at closer to 15 years of training before you can work on your own. And how much debt?
Too much.
Yeah. Why do they get paid so much? Because they got to pay their bills, okay? Now, if that's what you want to do, cool, go for it, okay? But just go into it with your eyes wide open, knowing that it's going to take a long, long, long time. Is there anything wrong with that? Think of it from a patient's perspective. If you have to have surgery, do you want the guy doing it to be somebody who just woke up one morning and went, you know what, I think I'll go to medical school? Or do you want it the guy who's wanted it so bad that he could taste it? From the time he was 10, wanted to be a doctor. Worked his way through school, worked really hard, struggled to get into medical school, worked her butt off in medical school, and then finally got that residency they wanted. You know? I don't know about you guys, but if somebody's going to cut me open, I want a perfectionist. You know? I don't want the guy that's going to look at the instrument he left inside me and go, we'll get it later. You know?
I had an appointment yesterday for my knee surgery, and the doctor, his birthday's next week, he's gonna turn 31. He goes, I'm 31 and I'm finally gonna get a real job. He's in the job this is his last year. He goes, I'm 31 years old and I'm finally gonna have a job. So it took him from 18 through high school, and he's 31, he's first getting hired as a doctor.
Yeah.
So it's a long haul.
It takes a long time. Right? Now, we haven't talked about nursing specialties. Things like surgical nurse, pediatric care nurse, ICU nurses. Okay, all of those specialties on top of nursing. How do you think you get those?
Advanced programs.
Advanced programs, yeah. Advanced training. Most of it's going to be clinical. Okay? But, do you think a orthopedic surgical nurse is going to make more than a pediatrics nurse? Maybe, maybe not. You know, who has a harder job? I would argue the pediatric care nurse, because if I'm a surgical nurse, my patients are either unconscious or well on their way when they come to see me, so I don't have to talk to them. But a pediatrics nurse, you get that 18-month-old with a double ear infection. Yeah, no. That would be a nightmare. Okay? For me, anyway. Everybody has their own views. Some people like that. Okay? Now, how do you find out about these jobs? What are some